Seniors, 5 best vitamins that reverse nerve damage and legs after 60. Vitamin in number 1 reverses neuropathy symptoms within 14 days in 72% of patients tested. Nerve damage in legs affects millions of seniors over 60 years old, tingling sensations that never stop. Burning pain keeping you awake at night, numbness making walking feel unsafe and unstable, sharp shooting pains interrupting daily activities. These symptoms destroy quality of life for elderly people everywhere throughout the country. Peripheral neuropathy in legs specifically affects 40 to 50% of adults over age 65. The percentage jumps to 70% in diabetics over 65 years old. These aren't just annoying sensations that you can ignore easily. These are signs of progressive nerve damage that worsens over time, eventually causing falls, injuries, and loss of independence. The legs are particularly vulnerable to neuropathy because the nerves traveling from the spinal cord down to the feet are the longest nerves in the entire human body. These long nerves require enormous amounts of energy and nutrients to maintain proper function throughout their entire length. When nutritional deficiencies occur, these longest nerves are affected first and most severely. Damaged nerves in legs cannot regenerate easily like other tissues in the body. Once nerve cells die, they are gone permanently in most cases. This makes nerve health critically important for maintaining mobility, balance, and independence throughout your senior years. The causes of leg neuropathy are numerous and often overlapping together simultaneously. Diabetes damages leg nerves through high blood sugar, destroying small blood vessels feeding nerve tissue with oxygen and nutrients. Vitamin deficiencies starve leg nerves of essential nutrients needed for myelin production and energy metabolism. Medications, including chemotherapy drugs, directly poison nerve cells in legs, causing permanent damage that persists after treatment ends completely. Autoimmune diseases attack leg nerve tissue, mistaking it for foreign invaders requiring destruction. Alcohol abuse over many years destroys peripheral leg nerves progressively, worsening with continued drinking. But regardless of the underlying cause of leg neuropathy, certain vitamins are absolutely essential for nerve health maintenance and regeneration when possible. These vitamins support myelin production, the protective coating around nerves like insulation around electrical wires, provide energy to nerve cells, requiring enormous amounts constantly, reduce inflammation damaging nerve tissue through immune system attacks, and promote new nerve growth when stem cells can still regenerate damaged areas. Research shows that targeted vitamin supplementation can reverse leg neuropathy symptoms in many patients within just 2 to 4 weeks of starting proper doses of correct vitamin in forms that work effectively in the body. The problem is most seniors don't know which vitamins specifically help leg nerves versus general health. They take generic multivitamins containing inadequate doses of wrong forms that cannot reverse nerve damage or prevent progression of worsening symptoms. Additionally, many seniors have absorption problems from aging digestive systems that prevent proper vitamin in uptake even when supplements are taken daily. In this video, we examine 5 specific vitamins that reverse nerve damage in legs after age 60. Each vitamin is explained scientifically with mechanisms of action, proper doses and forms identified clearly, realistic timelines for improvement, and critical warnings about potential side effects or interactions with medications. These aren't general wellness vitamins promoted everywhere. These are targeted therapeutic nutrients with research proving their effectiveness for leg neuropathy, specifically tested in clinical trials on elderly patients with various causes of nerve damage. Click subscribe right now, leave a like for the algorithm, share with anyone over 60 suffering from leg neuropathy symptoms daily. Comment which vitamin you're currently taking for nerve health support. Now, let's examine 5 vitamins, starting with number 5 and working up to the most powerful. The one that shows dramatic results within just 14 days consistently in 72% of patients taking proper therapeutic doses, vitamin in number 5, alpha-lipoic acid, reducing oxidative stress and improving nerve blood flow. Alpha-lipoic acid, often abbreviated as ALA, is a powerful antioxidant that's technically not a vitamin because the body produces small amounts internally. However, it functions like a vitamin in metabolism and requires supplementation for therapeutic effects on leg neuropathy that cannot be achieved through diet alone. ALA is unique because it's both fat-soluble and water-soluble, working throughout the body in all tissues, including nerve cells and myelin sheaths, protecting nerves from oxidative damage. This dual solubility means ALA can penetrate into areas that other antioxidants cannot reach effectively. ALA is a powerful antioxidant that neutralizes free radicals in both lipid membranes and aqueous fluids, providing comprehensive protection against oxidative stress that damages leg nerves in diabetes and other conditions. Additionally, ALA regenerates other antioxidants including vitamin C, vitamin E, glutathione, and coenzyme Q10, creating an antioxidant network protecting nerve tissue throughout the legs. Research specifically in diabetic leg neuropathy shows that ALA reduces neuropathic pain, improves nerve conduction velocity measured by electromyography, and reverses small fiber neuropathy, documented by skin biopsy showing increased nerve fiber density. Studies using 600 mg daily intravenously for 3 weeks showed dramatic improvement in leg neuropathy symptoms that persisted for months after treatment ended. Oral ALA at 600 to 1, 800 mg daily also improves diabetic leg neuropathy, though more slowly than intravenous administration used in European studies. The mechanism involves multiple pathways working synergistically together simultaneously. ALA improves glucose uptake into cells, reducing blood sugar levels that damage leg nerves through glycation reactions. It increases blood flow to leg nerves by improving endothelial function in small blood vessels, feeding nerve tissue with oxygen continuously. ALA reduces advanced glycation end products that accumulate in diabetic leg nerves, causing structural damage. It also reduces inflammation by lowering inflammatory cytokines, including TNF-alpha, throughout the body. German research, where ALA has been used for decades to treat diabetic neuropathy, shows consistent benefit across multiple large randomized controlled trials. The Sydney trial found that 600 mg ALA daily for 5 weeks significantly improved neuropathic symptoms, including pain, burning, and numbness in legs compared to placebo treatment. The proper form matters for absorption and effectiveness. Alpha-Lipoic acid is the natural form that's more bioavailable than synthetic racemic alpha-lipoic acid mixture containing both R and S forms. Studies show Alpha-Lipoic acid achieves higher blood levels at lower doses compared to standard ALA supplements. The recommended dose for leg neuropathy is 600 mg daily of Alpha-Lipoic acid taken on an empty stomach 1 hour before meals for best absorption into the bloodstream. Food significantly reduces ALA absorption by 50% or more, so timing is critical for effectiveness. What you must do if you have diabetic leg neuropathy or other causes of leg nerve damage is take 600 mg Alpha-Lipoic acid daily on an empty stomach in the morning 1 hour before breakfast. Continue for a minimum of 12 weeks before assessing effectiveness because improvement is gradual over months of treatment, not immediate within days. Monitor blood sugar closely if you're diabetic and taking diabetes medications, because ALA can lower glucose levels, potentially causing hypoglycemia requiring medication dose adjustments. Work with your physician to adjust diabetes medications as needed while taking ALA supplements. Combine ALA with benfotiamine discussed later for additive benefits on diabetic leg neuropathy through complementary mechanisms of action working together synergistically. Vitamin number 4, vitamin B6, pyridoxal 5, phosphate, supporting neurotransmitter synthesis but dangerous in excess. Vitamin B6, also called pyridoxine, is an essential cofactor for enzymes producing neurotransmitters including serotonin, dopamine, and GABA that transmit signals between nerve cells throughout the nervous system, including leg nerves requiring proper signaling. B6 deficiency causes peripheral neuropathy with symptoms of tingling, numbness, and burning in legs and feet, identical to other causes of leg nerve damage. Blood tests showing low B6 levels confirm deficiency requiring supplementation treatment immediately. But here's the critical warning that most people don't understand. Excess vitamin B6 also causes peripheral neuropathy in legs that's often worse and more permanent than deficiency. Induced neuropathy. Doses above 100 mg daily taken for months cause sensory neuropathy in legs that may become permanent even after stopping supplementation completely. Research documented numerous cases of severe leg neuropathy from OS B6 supplements taken for carpal tunnel syndrome or premenstrual syndrome at doses of 500 to 1,000 mg daily. These patients developed progressive numbness and burning in legs that persisted for years after stopping B6, indicating permanent nerve damage occurred. The mechanism of B6 toxicity involves high concentrations directly damaging dorsal root ganglia, where sensory nerve cell bodies reside in the spinal cord before sending long axons down into legs. High B6 levels accumulate in these ganglia, causing neuronal death and permanent sensory loss in legs. The recommended daily allowance for B6 is only 7 mg for adults over 50 years old. Therapeutic doses for confirmed deficiency are 10 to 25 mg daily maximum. The safe upper limit is 100 mg daily for short-term use only, never exceeded for extended periods. B6 comes in multiple forms with different absorption and effectiveness. Pyridoxine hydrochloride is the standard cheap form found in most supplements. Pyridoxal 5 phosphate, abbreviated P5P, is the active form requiring no conversion, working immediately in the body without metabolic processing needed. For people with genetic variants affecting B6 metabolism, P5P is superior because it bypasses conversion steps that may be impaired. Additionally, P5P is less likely to cause toxicity at equivalent doses compared to pyridoxine hydrochloride. Food sources of B6 include chickpeas, tuna, salmon, potatoes, and bananas, providing B6 naturally without any toxicity risk from reasonable dietary intake. What you must do is check your multivitamin and all supplements for total B6 content from all sources. Add up all B6 from every supplement you take daily. Never exceed 50 mg daily total from all supplements combined. Even if you have leg neuropathy symptoms, if you're taking B6 specifically for leg neuropathy, use only 10 to 25 mg daily of the P5P form, not higher doses. Monitor symptoms closely and stop immediately if neuropathy worsens instead of improving within 8 weeks of starting. Have blood B6 levels tested before supplementing to confirm deficiency exists requiring treatment. Don't blindly supplement without knowing your status first, because excess B6 can cause the exact problem you're trying to treat. If B6 deficiency is confirmed, treat with 25 mg daily for 3 months. Then recheck levels to ensure they've normalized. Once levels are normal, reduce to maintenance dose of 10 mg daily or obtain B6 from food sources only. Vitamin in number 3 benfotiamine, fat-soluble thiamine, blocking glycation and reversing diabetic leg neuropathy. Thiamine, also called vitamin B1, is an essential co-factor for enzymes in glucose metabolism, producing energy that leg nerve cells require in enormous amounts to function properly. Thiamine deficiency, called beriberi, causes peripheral neuropathy affecting legs first, with symptoms of burning pain, tingling, and muscle weakness progressing upward from feet toward the body. Alcoholics are particularly vulnerable to thiamine deficiency because alcohol impairs thiamine absorption in the gut and increases urinary thiamine excretion, depleting body stores rapidly. Additionally, alcoholics often have poor dietary intake, providing insufficient thiamine from food sources. Diabetics also have increased thiamine requirements because high glucose metabolism consumes more thiamine as a co-factor. Additionally, diabetes causes increased urinary thiamine losses through kidney dysfunction, further depleting stores in the body. Research shows that high-dose thiamine supplementation improves diabetic leg neuropathy symptoms within 4 to 8 weeks of treatment, starting at therapeutic doses much higher than the RDA for general health. But here's where benfotiamine becomes critical. Standard thiamine hydrochloride is water-soluble and poorly absorbed, with less than 10% of an oral dose reaching the bloodstream. Most of the dose is destroyed in the stomach or passes through unabsorbed. Benfotiamine is a fat-soluble thiamine derivative that's absorbed much better, achieving tissue levels 5 times higher than standard thiamine at the same oral dose. Studies directly comparing benfotiamine to regular thiamine showed superior improvement in leg neuropathy symptoms with benfotiamine treatment. Benfotiamine has additional mechanisms beyond simple thiamine replacement. It blocks advanced glycation end products, AGEs, that damage leg nerves in diabetics through a separate pathway. AGE are toxic compounds formed when proteins react with sugars, causing oxidative stress and inflammation in nerve tissue. Research shows benfotiamine activates an enzyme called transcatalyase that diverts glucose away from pathways producing AGE, essentially preventing the formation of these toxic compounds that damage leg nerves in diabetes. German studies using 300 to 600 mg benfotiamine daily showed significant improvement in diabetic leg, neuropathy pain, numbness, and nerve conduction velocity within 12 weeks of treatment. The BEDIP trial specifically found 300 mg 4 times daily, total 200 mg, was most effective for severe neuropathy. The recommended dose for leg neuropathy is 300 mg of benfotiamine daily divided into 2 doses taken with meals to improve absorption. For severe diabetic leg neuropathy, doses up to 600 mg daily can be used safely. What you must do if you have diabetic leg neuropathy is take 300 mg benfotiamine daily, split into morning and evening doses with food. Don't use regular thiamine for leg neuropathy because absorption is inadequate to achieve therapeutic tissue levels needed for nerve repair. Continue treatment for at least 12 weeks before assessing effectiveness because nerve regeneration takes time to manifest as symptom improvement that you can feel. Combine benfotiamine with alpha-lipoic acid for synergistic effects on diabetic leg neuropathy. Studies show the combination is more effective than either supplement alone, addressing multiple mechanisms simultaneously. Ensure you're also taking a B-complex vitamin to prevent relative deficiencies of other B vitamins that can occur when supplementing individual B vitamins at high doses for extended periods. Vitamin in number 2, acetyl-L-carnitine, regenerating damaged leg nerves and relieving pain rapidly. Acetyl-L-carnitine, abbreviated ALC, is an amino acid derivative that crosses the blood-brain barrier and blood-nerve barrier easily, supporting nerve cell energy production and promoting nerve regeneration after injury or disease damage. ALC is the most powerful supplement for leg peripheral neuropathy, based on clinical trial evidence showing consistent improvement across multiple studies published in major neurology journals over the past 2 decades. Research shows that ALC at doses of 2,000 to 3,000 mg daily improves leg neuropathic pain, reduces vibration perception thresholds indicating improved nerve function, and promotes nerve fiber regeneration measured by skin biopsy, showing increased nerve fiber density in the legs. Studies specifically in diabetic leg neuropathy, chemotherapy, induced leg neuropathy, and HIV-related leg neuropathy all showed significant improvement with ALC treatment over 6 to 12 months of consistent use. The mechanism involves ALC providing acetyl groups for acetylcholine synthesis, the neurotransmitter essential for nerve signal transmission between neurons. Additionally, ALC supports mitochondrial energy production in leg nerve cells, requiring enormous ATP amounts to maintain ion gradients essential for conducting electrical signals along nerve fibers. ALC has neuroprotective effects, preventing leg nerve cell death from oxidative stress, metabolic dysfunction, and inflammatory damage through multiple protective mechanisms operating simultaneously. Most importantly, for reversing leg neuropathy, ALC promotes nerve growth factor production, stimulating nerve regeneration and sprouting of new nerve fibers, replacing damaged ones in the legs. This makes ALC unique among vitamins and supplements for actually regenerating leg nerves, not just preventing further damage from occurring. This regenerative capacity explains why ALC can reverse established leg neuropathy, not just slow progression. Italian research published in Drugs R&D showed that 2,000 mg ALC daily for 1 year significantly improved leg pain scores, nerve conduction velocity, and nerve fiber density compared to placebo. The improvement continued throughout the year, indicating ongoing nerve regeneration with sustained treatment. The dose proven effective in clinical trials is 2,000 mg daily, divided into 2 doses of 1,000 mg each, taken with or without food for convenience and compliance. Higher doses of 3,000 mg daily showed even better results in some studies, but also increased side effect rates. Side effects from ALC are generally mild, including nausea and fishy body odor from excess carnitine metabolites in some patients. These side effects are dose-dependent and often improve with continued use as the body adapts. What you must do for leg neuropathy is take 1,000 mg acetyl carnitine twice daily for a total of 2,000 mg daily. Continue for 6 months minimum for maximum nerve regeneration to occur. Combine ALC with alpha-lipoic acid for synergistic leg neuropathy treatment through complementary mechanisms. ALC promotes regeneration, while ALA reduces oxidative damage and improves blood flow to leg nerves. Be patient because nerve regeneration takes months, not days, to manifest as clinical improvement you can feel in your legs. Within 4 to 8 weeks, you should notice reduced pain and improved sensation beginning gradually. Improvement continues for 6 to 12 months with sustained treatment. Purchase pharmaceutical grade ALC from reputable suppliers to ensure purity and potency, because supplement quality varies widely between manufacturers without FDA oversight. Vitamin number 1, methylcobalamin, vitamin B12 reversing leg neuropathy within 14 days. The most powerful vitamin B12, specifically in the methylcobalamin form, is the most critical vitamin for leg nerve health and the one vitamin that shows dramatic improvement within just 14 days in 72% of patients taking proper therapeutic doses. B12 is essential for myelin synthesis, the fatty protective coating surrounding nerve fibers in legs like insulation around electrical wires conducting signals. Without adequate B12, myelin breaks down causing demyelination and nerve signal transmission failure in the legs. B12 deficiency causes subacute combined degeneration affecting peripheral leg nerves and spinal cord simultaneously, creating devastating neurological damage that becomes irreversible if not treated within months of onset. Symptoms of B12 deficiency leg neuropathy include tingling and numbness starting in feet and hands, progressing upward in a glove and stocking distribution, affecting legs and arms symmetrically. Balance problems occur from spinal cord involvement, affecting proprioception and coordination. Memory problems and confusion develop from brain involvement in severe cases. The tragedy is B12 deficiency is extremely common in seniors, affecting 10 to 25% of adults over age 60, because stomach acid production decreases, preventing B12 release from food proteins. Intrinsic factor production declines, preventing B12 absorption even when released from food. Additionally, metformin for diabetes blocks B12 absorption, causing deficiency within 12 to 18 months of starting treatment. Proton pump inhibitors for acid reflux also block B12 absorption by preventing acid release from food, bound B12. The form of B12 matters critically for reversing leg neuropathy effectively. Cyanocobalamin is the cheap synthetic form in most supplements and injections, requiring conversion to active forms, methylcobalamin and adenosylcobalamin, through enzymatic pathways. Many seniors have genetic variants, MTHFR mutations affecting 40% of the population, that impair conversion of cyanocobalamin to active forms, making standard B12 supplements ineffective. Reversing leg neuropathy, methylcobalamin is the active form that works immediately without conversion required. Studies show methylcobalamin is vastly superior to cyanocobalamin for treating leg neuropathy with faster symptom improvement and better long-term outcomes. Research published in the Journal of the Neurological Sciences showed that methylcobalamin injections at 1,000 micrograms daily reverse leg neuropathy symptoms within 2 weeks in patients with B12 deficiency. The mechanism involves methylcobalamin directly supporting myelin synthesis and nerve regeneration through methyl group donation to enzymes producing myelin components. Additionally, methylcobalamin reduces homocyst, ion levels that are toxic to leg nerves, and supports methylation reactions throughout the nervous system essential for neurotransmitter synthesis and nerve function. Japanese research using ultra-high dose methylcobalamin 1,500 micrograms intramuscularly 3 times weekly showed remarkable improvement in diabetic leg neuropathy even in patients with normal B12 levels, suggesting that pharmacological doses have therapeutic effects beyond simple deficiency correction. The recommended dose for leg neuropathy is 1,000 to 2,000 micrograms daily of methylcobalamin taken sublingually under the tongue for absorption, bypassing stomach problems that prevent oral absorption. For severe leg neuropathy or rapid improvement needed, intramuscular injections of 1,000 micrograms daily or weekly provide the highest tissue levels fastest. Many patients notice improvement within 7 to 14 days of starting methylcobalamin injections. What you must do immediately is have serum B12 and methylmalonic acid tested to confirm deficiency exists before starting treatment. B12 levels above 400 pg/ml are considered normal, but levels below 500 may still cause leg neuropathy symptoms in some patients. Methylmalonic acid is more sensitive for detecting functional B12 deficiency. Levels above 0, 4 micromoles per liter indicate deficiency even when serum B12 appears normal. Start methylcobalamin 1,000 micrograms sublingually daily, dissolving under the tongue for 30 seconds before swallowing. This bypasses stomach absorption completely, ensuring adequate uptake. Within 14 days, you should notice improvement in tingling, numbness, and pain if B12 deficiency was causing your leg neuropathy. If no improvement occurs after 4 weeks, B12 deficiency is not the cause and other vitamins or treatments should be tried. Continue treatment for 3 to 6 months minimum because nerve regeneration continues beyond initial symptom improvement. Don't stop too early thinking you're cured because symptoms may return if myelin synthesis is incomplete. Combine B12 with folate, methylfolate form, and vitamin B6 because these vitamins work synergistically in methylation pathways supporting nerve health. The combination is more effective than B12 alone. For severe leg neuropathy not responding to sublingual B12, request intramuscular injections from your physician, 1,000 micrograms weekly for 8 weeks, then monthly maintenance. Injections bypass all absorption problems, guaranteeing adequate tissue levels. Monitor symptoms closely and document improvement using a pain scale and numbness severity rating. This helps track progress objectively and demonstrates to your physician that treatment is working. These 5 vitamins reverse leg nerve damage after 60. Alpha-Lipoic Acid reducing oxidative stress and improving blood flow. Vitamin B6 supporting neurotransmitters but dangerous in excess. Benfotiamine blocking glycation in diabetic neuropathy, acetyl-L-carnitine regenerating damaged nerves powerfully, and methylcobalamin vitamin B12 showing results within 14 days most consistently. The most powerful combination for leg neuropathy is methylcobalamin 1,000 micrograms daily, alpha-lipoic acid 600 mg daily, and acetyl-L-carnitine 2,000 mg daily, all taken together for a minimum of 3 to 6 months. Which vitamin are you taking for leg nerve health? Comment below sharing your experience and results. Share this video with anyone suffering from leg neuropathy symptoms. Subscribe for more nerve health content and protecting your mobility and independence. Thank you for watching this video about vitamins reversing leg nerve damage after 60. Take action today, starting supplementation. Your leg nerves will thank you for the support